my name is Josie Sammarco, and today I will be doing my Heroic Imagination project. So, what is a hero? I consider a hero somebody who does good things with no expectation of anything in return, and even if it comes at their own personal cost. And I know that the Heroic Imagination Project defines heroism, or an act of heroism, as an act that is given freely, basically, without any expectation of anything in return, and also without consideration of the cost. And I think that having both the qualifier of nothing in return and the cost is very important, because people can do things for other people, but it's somebody that really cares about their community or cares about whatever it is that is occurring, that is willing to put themselves in harm's way and inconvenience themselves. And I think that's really what makes a hero. So now talking more about Crossroad Health Center. Crossroad Health Center, their mission statement is giving honor to Jesus Christ by providing accessible, comprehensive health care in partnership with patients and the community, which leads to healthy lives. So this health center really services lower socioeconomic people, people without insurance, homeless people, people with unstable jobs, single moms, people who are really struggling to get by on a day-to-day basis. And the doctors and everybody that work here are completely aware of almost everyone that comes in's social, economic, and family situations, and is really mindful of all of that when they are helping treat them and care for them. So, why I consider them heroes? The first thing that came to mind for me was that this health center really approaches health from a multifaceted perspective. They look at the physical health of the individual, mental health, emotional health, and spiritual health, since this is a faith-based organization. So physically, obviously, you have your doctor's visit, and your doctor will come in and examine them completely, will get all of their medical history, any medications that they're on, they will take into consideration, just obviously your general primary care kind of setting. Then, kind of a special thing about Crossroad Health Center is that there's also a mental and emotional support system in place as well. The Over the Rhine location, at least, has two separate people that are licensed counselors that come in for each visit that a patient comes in for to help counsel them if they'd like it. And many patients actually choose to have this after their appointment, since it helps them decompress a little bit. But these counselors are there to help support and help kind of provide that mental stability and mental support that many of these patients in these really tough situations need. And spiritually, obviously, many of the doctors and nurses and medical assistants that work at Crossroad Health Center do identify as very strongly Christian and spiritual. And so if a patient were to need guidance in that area, all of the doctors and nurses are very willing to help them find that. The second thing that kind of helped identify them as kind of a hero, as really heroes to me, are that every single person that works in this health center looks at the patients as people and not as patients. You will never see a patient walk in and be dismissed or treated incorrectly or roughly. Everybody is treated with the utmost kindness and respect that any human being would deserve. The doctors care immensely about all of their patients, and they will personally stay late or come in early to call. They have Saturday hours for patients that have work schedules that don't allow them to come in on a 9 to 5, Monday to Friday basis. It's really actually quite amazing to see how much the doctors and nurses really care about the patient population that comes in. Many of the patients and doctors know each other fairly personally. Doctors will know all of the information, all the family details about their patients, and the patients will know about the doctors, and it's more like a conversation between two people instead of a doctor and a patient, and it kind of removes that authoritative barrier that I think often makes healthcare settings so intimidating for people who may not have the education or the financial means to normally go to things like this. Finally, Crossroads Health Center really fosters a community and team atmosphere within the employees, the volunteers like myself, and even between the patients, where everybody is really working together to have a better overall outcome for the patient, for the patient's family, and for the over the Rhine or West or whatever community that this health center is in. They're working to make that community better overall. So for me in the future, and why I kind of consider them heroes, and how I think that Crossroad Health Center inspires not only me, but other volunteers that work there, and even other people that hear about it, hopefully, is that Crossroad Health Center was started 25 years ago by 3 people in a one-room kind of setting in like a community center. And over the past 25 years, they've grown and have 5 locations now throughout Cincinnati, 17 physicians, so many staff members, and everybody is still kind of on the same page of really caring about the patient as an entire person and trying to transform their lives for the better in all ways as best they can. So hopefully, I'm hoping that Crossroads, as this kind of heroic institution, inspires other people to have community service and to make small changes that can help in their own communities. And I always like to say that change starts with you, so even something very small can really make a big impact on the community. And then in terms of inspiring myself, just seeing the people at Crossroads and how they interact with patients and the patient population there, and just being able to experience the great need that is there. I am for sure going to continue working at Crossroad Health Center to help empower their mission, and also hopefully going to pursue a career in public health so that way I can help with many of the issues within the system. And finally, I will be encouraging others directly and indirectly to do the same. Thank you.